Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you for joining us for this week's cross-industry update on safer at home openings for businesses. Again, we'll cover general information, but if you have industry-specific questions, please feel free to ask those as well as those cross-industry questions. Just because it says cross-industry, we are supporting all the industries that we did before. At this time, I'm going to hand it off to Boulder County Public Health, but while they're speaking, if you have questions, put them in the Q&A or the chat, and we'll make sure to ask them on your behalf.
All right, thanks, Corinne. Hi, I'm Jesse Rounds. I'm with Boulder County Public Health, and I will run us through this update. So I'm going to talk a little bit about the current state of the pandemic, our public health and face covering orders, what this all means, and then how we can help, and then happy to jump into your questions. I know that's really where we can address a lot of concerns. So that's where we want to get to as quickly as possible. So just to start, you've probably seen this slide a number of times, but I promise it's changing. This is the 5-day average of number of new cases in Boulder County. And I think you can see the thing that concerns us, and that is that since the beginning of June, we've just had this, July, we've had this sort of steady increase. While I believe it was Monday, we had only 7 cases, then it was followed by an 11 case day. So we're still seeing that steady increase in number of cases. And that's a lot of where our concern comes from. I guess, you know, this is out of the study that came from the Colorado School of Public Health, and this is their conjecture at the end of their study. They listed these 4 reasons about what's driving the rapid increase in positive cases across the state. This is, and they said, you know, the relaxed rules and the fact that we have to keep on trying to figure out how to adhere to those rules. So I think they're recognizing the stress that we're all under, trying to understand and adapt to those rules. Younger people are interacting. We saw that with the spike back in June, and just generally it's summertime, people are outside, people want to do things together. There are more out-of-state visitors, and conversely, we're, as Coloradans, going out of state and coming back. And then they just recognize that really some of this could just be random. You know, it could just be an increase based on chance. But all those mixed together are why we're seeing this increase, and why we might need to start thinking about adjusting our behaviors. From our epidemiological team, they sent over these 3 sort of main takeaways from the chart, the 5-day average, and their broad epidemiological update that they do on Tuesdays. And that is, we had a very high new case counts over the weekend. We are continuing to see a disparity of infections in the Latinx community. The Latinx community comprises about 14% of the county's population, and they account for 35% of our cases. And so that's a very worrying thing that we need to try and address. And then finally, the highest case counts. I've mentioned this a couple of times now in different settings, and it's just a very wide group of people. Really from 10 to almost 40, we're just seeing highest case counts in those groups. So younger, young adults, older kids, that's where we're seeing this increase, and that's a worrying trend as well. In fact, we're seeing very few cases in nursing homes at this point, and in care facilities. So that's a significant change from the early part of the pandemic. One thing I really wanted to highlight that I think is a really positive change is that so our epidemiological data team worked with volunteers to visit a number of sites across the county in July, and they looked at various locations in the city, in various cities, and various types of businesses. And I think that the big takeaway here, if you ignore the park data, which is a little bit fraught because there is actually only the county requires that you have to have a mask on if you're within 6 feet of another person. Yes, sorry, I'm going to be louder now. But what we're seeing is really high percentages of mask wearing in stores, in service areas, regardless of the size of the business, and that's really good news. That's a really big positive step. And I just wanted to point out that that's regardless of location as well. In our municipalities, we're seeing really high, observance across the board, and that's just really good news. It's a positive step for us, and it's going to have positive impacts. Shifting gears again, just want to update you all that there was a 9th revision to the Safer at Home public health order that came out on the 31st, but it really was focused on addressing the mask order that came out on the 16th, and basically putting the guidance from the mask order, the rules from the mask order, into the Safer at Home guidance. So things like in the past, the guidance for critical retail said that employees needed to wear or to observe social distancing guidelines. Now it says that all retail employees need to be wearing face coverings while they're inside and can't make, and yeah, while they're inside public spaces. So that's that order. And then, this is a slide that's been in the presentation deck for a couple weeks now. Statewide face covering order, we still have not, he still has not extended that. But our countywide face covering order is in line with the statewide face covering order, and it is in place indefinitely. So if for whatever reason the state order goes out of, it is not extended, our face covering order is indefinite. And then on top of that, all the businesses located within municipalities need to be aware that there are local face covering orders, municipal face covering orders that you also need to abide by. And we had some questions last week about the Boulder face covering order. And while we can do that research and get back to you, I really encourage you to contact your cities if you have a question about their specific face covering order or how exactly they view the face covering order. Their face covering orders have to be more strict than the county or than the states. That's the rules. Just to sort of highlight the two very basic rules that come out of the state and county orders. The state orders say that everyone over the age of 10 must wear a face covering in public spaces indoors. The county adds that everyone over the age of 10 must wear a face covering outdoors if social distancing cannot be maintained. So that's our added layer on top of the state's order. The state also requires first they require that you post a mask order sign at your front door. Every business has to have it, and it basically has to say, it can be as simple as this sign that I have here, and you can get this on the state's website, covid19.colorado.gov. You can get this sign, and it complies with their order. But basically, you need to be able to show that you are informing your customers that they need to be masked before they enter your premises. These other notes here I want to highlight. You can provide alternatives for those who can't or won't wear masks. There is a medical exemption, but we also want to note that the civil rights guidance from the state says that businesses can deny service to anyone who cannot or won't wear a mask. That provision of alternatives is important. You want to be able to make sure that customers can get curbside service or online service, but you have the right to say to anyone who won't wear a mask, regardless of whether they have a medical exemption or not, that they are not allowed in your store or your business of any type. Sorry, I clicked on the wrong thing. Oh, sorry. And this is, again, a slide that's been in a lot of our presentations, and I think it just really drives home the fact that the choices we make, the travel choices we make, the recreation choices we make, have an impact on the risk we pose to ourselves and to those around us. And it's not to say that any one activity is not appropriate, but you should be aware of what the activity, what it implies about how risky you're being, and think about how that then affects other activities that you're thinking about pursuing. In terms of how we can help, webinars like this, phone calls, we've had meetings with individual businesses where we get a couple employees, Boulder County Public Health employees on the line, and we try to work out the issues that you're seeing day to day in your business. We interpret the orders. We work with our county attorney's office to interpret the orders and get information out about any changes that come up. We do enforcement. We are actively looking into enforcement against a number of businesses, and it's not, what we're really trying to do is drive that compliance. We are not out closing businesses or anything like that. What we're looking for is, hey, by the way, there's an order, you need to comply with it, and there are consequences if you don't. We provide outbreak guidance, both to the businesses and to infected individuals. And then we wanted to point you to our resources. We've got our own Boulder County website with a lot of great resources that have been developed in-house or linked to state and national resources. And then CDPHE is where we get all of our basic, this is what the order says information. They both maintain the order itself and all of their interpretations of that order on that website, covid19.colorado.gov. The next couple slides, I guess I want to keep reinforcing these basic things we can all do. And this comes from the state. And I mean, it really is, we just need to wash our hands, physically distance, wear a mask, and monitor your health. I mean, be aware of how you're feeling, and because you can catch those symptoms early, and by quarantining or limiting interactions, you can stop that spread. And then finally, at the community level, it's things like the facial covering order, the public health order, and cleaning and disinfecting public spaces regularly that are going to reduce transmission as a community. So with that, just common Q&A that we're getting, we are trying to help our community deal with this mask issue. We have a mask script on our website that helps you walk through a negative interaction with or avoid a negative interaction with a customer. That civil rights guidance that I mentioned is actually on an earlier slide, but it's also on our website and on the CDPHE website. And then we've just updated our outbreak guidance, and that's really for businesses to understand what you need to do if you have a sick employee. It does cover outbreaks, but it's also like if you have one individual, that's not an outbreak yet, but you do need to be conscientious of what that means for your employees and for your customers. And then finally, this has come up a ton. Do I have to wear a mask in the office? The answer is yes, you have to wear a mask in the office. If you are in a room by yourself with 4 walls and a closed door, you can take that mask off. However, you ought to be very aware that anybody could walk into that office at any time and you'd need to put a mask on. So we really recommend when you're inside a public building, wear a mask. That's the law, and it's good practice. With that, just want to again highlight today at 4 o'clock, we're having a session just dedicated to masks. Happy to answer questions about masks now, but definitely if you want to stick around then and at 4, and we can dive deep on masks. And then a Spanish language session is released, I believe it's Thursday morning. And what they do is they're focusing on specific questions, but also relaying a lot of this same information in a Spanish language session that gets recorded. And with that, just wanted to provide our email address for questions. And then if you have complaints or concerns, you can call our call center 9 a.m. to 2 p.m. Monday to Friday, and we follow up on those as quickly as we can. Happy to take questions.
You have a lot of them coming in.
Great.
All right. So I think part of the confusion and why you're probably getting a lot of questions from offices about do you have to wear a mask is because of the term public spaces. You know, when you're in a public space or public, can you help define public space and why that comes in with offices and manufacturing facilities and real estate offices, and why they're considered a public space under the mask order?
Absolutely. So under the mask order, which is Executive Order D 2020-138, subsection R, paragraph R, I guess, says, for the purposes of this executive order, public indoor spaces means any enclosed indoor area that is publicly or privately owned, managed, or operated, to which individuals have access by right or by invitation, expressed or implied, and that is accessible to the public, serves as a place of employment, or is an entity providing services. Public indoor spaces does not mean a person's residence, including a room in a motel or hotel, or a residential room for students at an educational facility. So that's directly where we're getting that, and that really covers any place except for your house.
So because an office is people from different households coming into a space that's considered a public space at that point, because yes, you're entering another facility with people that you're not related to.
Exactly.
Okay. And then the 4 walls and a door, we get this question, you know, like, I'm in a cubicle. That doesn't satisfy that 4 walls and a door. And the door needs to be closed.
Yep.
And oftentimes, you know, if it's a space that other people are using, you probably want to disinfect between if you've been taking off your mask.
Absolutely. And I hope, I know I had it on one slide. I probably should have put it some other places. That disinfecting thing, it appears in every set of guidance. Definitely keep disinfecting the spaces, public spaces, and that includes any space where you have more than 2 people from, you know, unrelated people. Like you need to be thinking about the transmission in those spaces, and so cleaning spaces is really important.
Yeah, I was in my office the other day and I didn't even realize what you touch when you're in there, where you put your elbow down, where you're touching, where you're standing, and to just, you know, having that COVID monitor go around and check, oh wait, that's actually a public space too, that bookshelf or that copier or the, you know, the postage machine or that area can get people to think about what is really a public space, which is hard when you're in an office. These are my coworkers. They're not the public, they're my coworkers,
right?
But it is considered public.
Absolutely.
All right, so we have quite a few questions about masks. This question says, we know you're not exactly the city, but there was some concern about the annual softball tournament at Mapleton Fields last weekend. There were a lot of people not social distancing and not wearing masks. Can you explain that, or where that falls in the enforcement arena?
Sure. So, well, I mean, I'll start by saying that, yeah, we've been in touch with the city, and they, you know, they have updated their regulations based on what happened. But the outdoor recreation team sports guidance for for youth says that 25 people on a field, excluding umpires and coaches, so 25 kids can be on the field. There are regulations about how close they can be, all that kind of stuff. But it also says that while spectating is discouraged, parents are allowed. It's for safety, and obviously you want to see your kids playing sports. But it also says everyone has to be masked and socially distanced. And that's clear in the guidance. What happened was the fields are rented by an organization, and that organization signs a document that says we have to abide by all the rules, state and county and local rules, and unfortunately they failed to do that. And that is it's a big step, and it's one of those things that each organization that's going to host this sort of thing needs to think about before they do. When you host an event, you take on responsibility for maintaining those rules. So it's not on the city, it's not on public health, it's not on the police to make sure that parents are social distancing when watching their kids play softball. We will enforce, and we will stop or cancel an event if we see that happening. And in this case, we, is the City of Boulder Parks and Rec Department, did that. But it is really on the organization and on the individuals out there to make sure that they are protecting each other and the children playing sports. This is personal responsibility. We all have to take on that responsibility in order to go out and do things. That's why we got released from stay at home, because people thought we could safely do things and be responsible, and we have to maintain that.
So I've heard, comments like, "Oh, but our parents won't tell on us," or "We're all family," or those types of things. But I've also heard that there are individuals not associated with your group that are watching from the neighborhoods around there, from whether it's Mapleton or near Iris or some of those parks, and are reporting. So it's not just your families, it's others that are observing the behaviors and commenting to authorities and so forth.
And I would add to that there are, I think we know who reported that softball league, but we also get comments from parents who drop their kids off at locations and are nervous, and people are not comfortable walking up to you as a business owners to say, "Hey, you're not following the rules," so they call us, and then we call you, and that's unfortunate. We've encouraged some businesses to post signs saying, "If you see something that bothers you, say something to us," because obviously you are there, you can address concerns immediately and have fewer consequences in the long run. But not everybody's comfortable walking up to a person of authority and saying, "Hey, you are not following the rules."
And so you should make the assumptions and nobody in your group will turn you. Same thing with employees. We've heard from employees who say, "This is the practice in my office. I don't feel comfortable speaking up because I'll be taking away what other people feel they want to do." So they contact you. So there's this assumption that everybody's on board, but that's not always the case.
Yep.
Okay. So someone says they were at their dentist's office, and the receptionist at checkout did not have a mask on, and this person was appalled and disappointed. Are they required to have a mask on at the reception desk at a dentist's office?
Yes, they absolutely are. Again, they were required from the very beginning because they're a healthcare facility. But on top of that, indoors, in public indoor spaces, which include a dentist's office, they need to be wearing masks. And I encourage you, if you see something like that, to call our call center. You also can, if you feel comfortable, say something to the receptionist. Again, not a lot of people are super comfortable telling another adult how to behave.
Well, it's funny because this person did apparently say something and they said they didn't need to wear one because they're behind a desk.
Nope.
So I think there's
Desks
still
don't
some,
block the virus.
there's some definite misinformation still out there. So in that case, probably good to help to maybe call you guys so that we can
Absolutely.
get out there and educate. I've heard similar things like, oh, once you're stationary and seated someplace inside, you can take your mask off. Again, misinformation.
Yep. And that, just to address that for everyone on the call, like the public health order, or I'm sorry, the mask order does say entering or moving through a public indoor space. And so people were like, oh, once I'm seated, I don't have to wear a mask. That is not true. That is not the interpretation that the CDPHE or Boulder County are taking. It is inside a public space, you need to be wearing a mask.
Okay. So are masks required for outdoor dining? Can they be removed once seated or only while actively eating or drinking?
That's a judgment call on your part. Once you're seated, I think that the rules are while eating, but, and Lane, I don't know if you may know a little bit more about exactly how that plays out in the rules, but my understanding is that you can take your mask off once you're seated and are eating. You don't have to put it back on every time you're not eating. But if you get up from your table to go to the bathroom, put the mask on. But you don't have to put it on between bites, basically.
So I have heard some restaurants wish that they would put them on when the server comes up. So having them handy for when your server comes up to protect your server as well. Whereas servers are being advised to stay away unless they're delivering, to maybe be respectful of your server as well when they come up and talk to you and you're talking back, to maybe have it handy.
That's a really good point. I mean, there certainly is some, it may be nice to think about the concerns of the people you're talking to. They can't necessarily tell you how they feel.
All right, I'm going to try to end with these mask questions and move on to one last mask question. Is the mask mandate working? If so, do you expect it to continue or do you think it will be rescinded?
So I think that the slide I showed of the Sentinel survey that showed how many people, the percentage of people wearing masks, shows that people are complying. In terms of whether it's working, I think that takes a lot more time to suss out in the details and in the data. And I think that's why it needs to stay in place long term. And that's why the Director of Public Health put our mask order on indefinitely. I think there's a lesson to be learned by saying things are looking okay, let's open things up a little bit, and then you see a big surge. It makes sense to go a little bit further than we're all happy with things like a mask order, so that we can be sure we're through the worst of it, through the pandemic. But in terms of data showing that the mask orders have been the only reason that we're seeing changes, I don't know of any. Lane, do you know of any data like that?
No, I think it's such a dynamic situation to look at what are the causes of disease. And so we know there's a lot of factors. Travel right now is definitely playing a role. So people that are traveling are potentially getting affected, or people that are coming here are bringing it. But I think the data that we do know is we're seeing very high compliance in Boulder County, higher likely than really anywhere else in the metro area. And that, I think, also helps contribute to us having lower incidence of disease relative to our metro peers. I think Douglas County is about the only other metro county that has lower rates than Boulder County does. So Again, there's a lot of different factors, but we know there are municipal, county, and state mask orders. So Boulder County has very comprehensive mask requirements. But there's a lot of different places people are getting sick. When we look back at the other demographics of our highest rates are more in younger groups. And those are likely coming from activities where people maybe not be wearing masks. So it could be sports, it could be a lot of different factors. Kids are definitely playing with each other at the parks. So again, outdoor exposures, while indoor is much higher risk, does not mean you cannot transmit it outdoors. So there's just so many factors in all of this. But we know masks are effective means for prevention. And I do not see that going away in Boulder County at all until we're at a different situation, meaning we have really widespread immunity through vaccines and overall herd immunity.
So be prepared to be wearing masks for a while.
Yeah, it really needs to just be part of our normal activity now. I know that it's caused frustration for a lot of different businesses on having to enforce it. There's a small percentage of people, and we can just see by our numbers, it's a very small amount that are not wearing masks. But I think people have drawn a line in the sand. They don't want their rights infringed. They feel like they need to express themselves and not be told what to do. But this is a really simple thing. You know, people almost all largely wear your seatbelts now. It's just part of our culture of things we do just to protect ourselves and each other.
Well, and in other countries during flu season, people wear masks. It's a pretty normal thing. It might become a pretty normal thing even post-COVID for us to wear masks when we're sick out and out.
I mean, it would be a wonderful thing that it becomes socially acceptable, because it does. It helps prevent a lot of respiratory disease that we see annually in our country. And we see annually large numbers of flu deaths every year that we sort of become socially acceptable, that could be prevented.
So I thought I was done with mask questions, but we have a couple more that came in. Do you think there will be a transition to wearing masks outdoors as well?
Well, it is required whenever you can't socially distance. And so I think our big mantra is you should always have a mask with you whenever you leave your house, and be prepared to wear it anytime you're going to be interacting with other folks. So it's just a good idea that unless you know you're walking by yourself and you can always socially distance from folks, but as soon as you're going to go into areas that are going to be more, see more people, you need to have a mask and be prepared to wear it. And that's already required by our county order and the municipal orders.
So when in doubt, bring it out. You're masked. So you should always have one on you. I think another parent and I were joking that, you know, you ask your kids, do you have your shoes on? Do you have your socks? Did you brush your teeth? Do you have your mask? So it's just that one extra piece that we remind people, do you have a mask when we go out? All right, so you talked a little bit about younger people. So there's a question, what do you think will happen when college kids head back to CU?
Oh, we're actively
preparing for that. I know Jesse and I specifically are on some work groups with CU. We're also talking to the city of Boulder. Our surveillance people have been working with the university specifically. They have their own systems to do case investigation and trace and follow-up work. There's been education efforts with the students to make sure they're more aware, but we're pretty concerned just the influx of that many people to our community. When we look at the amount of people that are currently testing positive, you know, say it's 3%. Well, if 9,000 people come to a city and 3% of them are sick, we just brought in hundreds of new cases all in the same week. So we're just concerned just from that large number of people that some percentage of them will be sick. Some are coming from out of state and states that have even higher rates than Colorado. So we are concerned. We're bolstering our epi staff to be prepared for more of that investigation work. But it is a reality that just that many new people in the community have the potential to bring disease with them. And then the interaction from there is another area of concern. But we're trying to work with the various groups to be prepared for it.
Well, and I've heard you talk about the the buff campaign, protect our herd campaign, and just trying to communicate to students in a way that is effective for students. And we've also learned that there's a way to translate that to businesses as well, rewarding people when they come in with a mask and students coming with a mask, communicating with your employees, a lot of which are students or younger people, about the necessities of following public health orders and its impact on your business. So just, there's going to be a role for the entire community in helping to protect that herd, and so forth.
And many of the students will potentially seek employment within our area. So it's really important that they get quickly indoctrinated into the importance of the steps, how important it is for protecting your coworkers, certainly the patrons and yourselves, so that we don't see a lot of problems and a lot of disease spread.
Okay, so I'm going to get into a little bit of 2 technical questions about specific industries. One particularly around recreation. Someone needs some guidance regarding 2 swimmers from the same household using 1 lane and another person from a different household using the lane next to that. Is it okay to do that? Because they may be less than 6 feet separation for a few seconds.
So the guidance does not say that you can only have 1 person per lane, and various I think the different recreation centers are handling it differently. Some are still requiring only 1 person per lane. Others are allowing 2. And they are following, as far as we understand it, and we've talked to them extensively, they're following the guidance. And so yes, you could have 2 people in a lane that are related and next to them another person who is not related in a separate lane. And I think that is, well, I know that complies with the order. And I know that there are recreation centers doing that. I would say that, it's something that we're aware of and we're talking to those recreation providers about.
But make sure you're maintaining the occupancy levels of those no more than 50 people, or 25%, whatever of your capacity.
Absolutely.
And I think the hard part is the order doesn't really get into the how many people per lane. It talks about staying at least 6 feet away from other swimmers. So again, it's the challenges we run into with the state language, but so that's, I guess, the safest answer we can give you is that swimmers should be maintaining 6 feet of social distancing. And so whatever orientations you can configure to allow for that then complies. And if you can't, you may not be complying.
Right.
Okay. Where do indoor events stand at this time? Specifically, let's take a venue like the Boulder Theater. Can they host events even though they're considered a tavern and the state closed the bars?
So, I mean, it depends a lot on the space. I don't know how the tavern license interacts with that, but I would say that, and Lane, you may know better, but in terms of hosting an event, you are allowed to host an indoor event up to 100 people as long as your space allows up to 100 people. So you'd have to use the space calculator to figure out how many people could fit in the Boulder Theater. And then you can only have a bar open if you have an associated food service provider. There is a ton of guidance on the web, covid19.colorado.gov, about what you need to do to open an indoor venue. It is complex. It requires cleaning constantly. But if you have, I would really encourage any individual business that's considering opening up and doing indoor events to contact us. especially the larger venues, so that we can talk through exactly how that'll happen. It's a good idea to look at the guidance, come up with a plan, and then share that plan with us, and we can tell you whether the plan complies.
And I posted the link to the indoor events site. And as Jesse mentioned, it's pretty extensive. It walks through all of the different situations and pieces of your facility that you're going to have to run through, from how people queue to get into your facility to all the different types of activities you might be thinking of having. So it really does walk you through exactly what is allowed and what's not. Then if you run into situations where you don't see it covered in there, definitely reach out for clarification. And as Jesse mentioned, if you're really planning large events, it is a good idea to send that to us so we can really review it.
There was talk early on that any event over 50 people would have to get approval from Boulder County. Is that still the case, or is it best just to kind of run through how you would put on an event, a larger event, looking at your spacing calculator?
Doesn't require approval. I think really, again, it would be looking at what you're trying to do, but there's not a mandate that if it's over 50 people, it has to be approved by Boulder County. Really the maximum is 100. I guess the caveats are, the type of event you're planning, indoor, outdoor, there's all sorts of other layers of, if you're getting liquor licenses, if you're looking at closing down streets, and there's other permits required. So I hate to give a blanket statement that it doesn't require approval, because there's all sorts of different approvals that could be needed from the county and various departments. So, but for COVID specifically, it doesn't require an approval once you hit 51 people.
And some of the venues have just been, they have a way that they operate. This is how our events will, no matter who the vendor is that's coming in. And those are the types of things that they're presenting to Boulder County Public Health to say, if this is how we're running it in accordance with the county rules or the state rules. Okay, so we have a couple more questions. Jesse, can you go back to the why we are seeing these trends slide again for someone?
I can. Somewhere back here.
Yeah.
Yes. Happy to talk about those if people have questions.
There you go. So we're seeing upward trends because there have been some relaxed rules, people interacting, more out-of-state visitors, and some random chants. Those are the things that you've indicated there.
Yep, and that comes out of the Colorado School of Public Health's their report on trends. They developed a bunch of models and tried to look at, in various scenarios, what could happen in the future, in the near future.
All right, and then I'm probably in this week
gonna
gonna
take home of why we're seeing the trends increase.
I'll probably send the modeling link that the governor sends out, just for people who are geeks about all this information and understanding the trends and what the School of Public Health's been putting out. I'll send that out for individuals to look at. We have one more very specific question, but this has to do with masks. Is there any indication that the indoor mask requirement will be modified so as to account for large facilities and small numbers of people within those facilities? For example, a climbing gym with 30,000 square feet, or a tennis club that has 4 players and 1 coach on a court that's spaced out. Those were some examples.
And I have not heard any indication that masking orders are likely to change for indoor spaces. I think indoor spaces are where we're seeing transmission, and so that's that. But Lane, you may know more about discussions happening.
I don't know what the state's intention will be. I know that there is a desire, and there's some letters from the metro directors and public health directors that are encouraging both the continuation of a state order and I think potentially looking at some of the language in it. But again, to know what the state will ultimately do, we don't have any think on that. So.
All right, are there any other questions? We had quite a few today. So thank you for continuing to have these sessions because we continue to get questions.
Absolutely.
All right, so with that, just know that we'll send out a recording of this video. There are specific resources that were mentioned in this or previous ones that you want access to or that I don't send out, please let me know. Oh, so a question, who do you contact to go over an events plan?
So you can contact, I'll move the slides forward. You can send it to our main email address or you can contact me. But it's probably easiest to contact the covidbiz@bouldercounty.org and one of our team will get back to you.
Great.
The COVID biz is always the best, you know, depending on the sector, depending on the issue, and depending on the volume we're getting, we're bouncing that through a team of folks. So it coming in there, we'll be able to sort it and try and get to it as soon as we can.
Great. Thank you. So again, my email will just give some general information, new updates. All right, we got another question that just came in. I can't finish that train of thought. We have another one. What if any differences are there between the state and Boulder County Health Department recommendations for health?
I'm not sure that that's pretty broad. Hopefully there aren't, you know, I think we recognize, the state recognizes it's really important for people when you're sick to stay home, that you're washing your hands, that you're wearing masks and social distancing. So all the messaging around what prevents this should be consistent. We don't have different orders outside of our mask order has an outdoor component, but the indoor component has been changed to match the state. So again, I think the messaging hopefully has stayed consistent of how people can really, you know, address and prevent this disease spread. It's those same pieces once we've started this.
Boulder County Public Health is following the state orders as far as the industry-specific state orders on requirements. Like you said, the only difference is in the mask order is the outdoor component. Okay, I'll be sending out a recording of today's session, as well as the normal resources and any updates in a general updates area. Please join us each week. We're here. Jesse and Lane are great to do this every week with us on Wednesdays to answer those questions. They can be industry specific, as you saw today, and they can be general that are across the industries. In the meantime, I hope everybody has a wonderful end of their week, and we'll see you next week.
Thanks, everybody. Thanks, Corinne and Lane.